Greetings. This is Justin Allen with the Elite Nurse Practitioner. This is the Thyroid Optimization Course. This is the Elite Nurse Practitioner guide on how to integrate thyroid optimization from a functional medicine standpoint into your practice. I'm really excited to release this course. It's a really fun little course. We're going to teach you how to optimize the thyroid from an integrative medicine, functional medicine standpoint, okay? We're predominantly going to be talking about optimizing hypothyroidism. We will discuss hyperthyroidism considerations for a nurse practitioner, but the biggest part of this course will be optimizing low thyroid levels. The authors of the course, obviously it's me, Justin Allen, family nurse practitioner, owner, operator of the Elite Nurse Practitioner. I also own 2 men's health practices and a medical cannabis clinic. We went from 0 to 70,000 a month in just 2.5 years. So these little wellness practices, HRT practices, are very lucrative, and plus it'll help set you free from the standard medical model of insurance, working 5 days a week and seeing 30 patients a day, okay? I couldn't imagine going back to that. Justin Groce, nurse practitioner. He has collaborated on multiple Elite NP courses with me, including the weight loss course and the peptide course. He is owner of the Restore Clinic. He provides men's health, HRT, integrative medicine, and wellness services. He predominantly operates via telemedicine, but also has a physical location. He's also one of the leading voices with alternative and integrative medicine approaches for nurse practitioners. And it's a pleasure to collaborate with him on another course. All right, so what is thyroid optimization? Put simply, it is bringing low to low normal thyroid hormone levels into the optimal range. We will talk about what that optimal range is. Suboptimal thyroid hormone levels can plague your patients with a variety of symptoms that are often chalked up to other disease processes. So if you treat the underlying issue, the suboptimal thyroid level, and you treat the problem. I have seen many patients with anxiety, with depression, inability to lose weight, and you optimize their thyroid levels and the symptoms go away. So you tell me what's safer, putting someone on an SSRI or putting someone on a natural hormone and just getting their levels up into the optimal range. So being able to identify hyperthyroidism and offer appropriate referral is also another aspect of thyroid optimization. So we will talk about hyperthyroidism as well. There's not really much of an integrative approach that you can take with it. Usually this does require medical treatment. All right, we will talk about that. So what can thyroid optimization do for your patients? What symptoms can thyroid optimization treat and improve? So it can improve weight loss efforts, sexual function, mental well-being, cold intolerance. It improves skin, improves hair, improves nail quality. It improves cognition. When your thyroid levels are optimized, you can think faster, you can think clearer. It improves subjective sense of well-being. When the thyroid is optimized, you just feel better overall. It can also slow the aging process. Many anti-aging, functional medicine, and integrative medicine practices provide thyroid optimization services for a reason. This is just a small list of what thyroid optimization can do for your patients. Overall, most patients love the way they feel when the thyroid is optimized. So essentially, it helps your patients feel and look better, even if the hormone levels are just suboptimal, okay? So why manage thyroid disease and optimize thyroid hormones in your practice? Patients are actively looking for thyroid optimization. They hear about this on YouTube. They hear about this on a podcast. They read about it, all right? They want to know if their thyroid is functioning right. So many patients want this. They're looking for it. It helps your patients feel and look better. Plus it treats bothersome symptoms and other disease processes. And we'll cover that in more detail throughout the course. And it also provides an additional revenue stream and service in your practice. This service line complements almost any kind of practice. It really does. And if you're operating a cash practice, then having multiple service lines that complement your main service line is just good business, okay? So this will help increase your patient volume and to increase patient satisfaction and to overall just increase the value of the services you are providing. And that's where it is all at when it comes to a cash practice. It's so critically important. So treating low thyroid function will be the bread and butter of offering thyroid optimization services. Hypothyroidism is totally within the scope of any nurse practitioner, including psych, and we are going to talk about that. So treating primary, secondary hypothyroidism, subclinical hypothyroidism, and sublaboratory hypothyroidism is what you will be doing in practice for the most part when it comes to treating the thyroid and providing thyroid optimization treatment. So what type of practices could benefit from integrating thyroid optimization into it? Weight loss clinics, Most definitely. Every single weight loss patient should receive thyroid hormone testing. Every weight loss patient should receive a thorough lab analysis before treatment is started, because why put someone on phentermine when you could just optimize their thyroid instead and they lose weight? If someone's thyroid is operating slowly and you put them on phentermine, you're just masking it, okay? Treat the underlying issue. Hormone replacement therapy clinics, men's and women's health. Sure, if you are optimizing someone's testosterone, estrogen, progesterone, whatever it may be, the thyroid is also something that you can optimize in addition to those other services. It's a piece of cake, guys. It's not that difficult. Sexual medicine clinics, dermatology clinics, it does improve skin quality. Aesthetics practices, obviously, again, improves skin, hair, nail quality. Wellness clinics, anti-aging practices, obviously integrative medicine, functional medicine practices. This course is predominantly an integrative medicine type of course and subject. Primary care clinics. Most primary care providers do not know how to do this, and it's a real disservice to patients, all right? We will talk about how to bill this for insurance, all right? It's going to be just basic standard E&M codes. So if you do have an insurance accepting practice, we will talk about how to bill for this, but it's really no different than just any other kind of visit. And IV infusion hydration practices, all right? If you're going to be doing blood work on people or you want to offer complimentary services in an IV infusion clinic, this is a great complimentary service to add to it. This is just a good service to offer in the majority of wellness type practices. So the course content, we're going to talk about the pathophysiology of thyroid disease, the symptoms and consequences of thyroid disease, types of thyroid disease. Okay, we're going to go over primary, secondary hypothyroidism, subclinical hypothyroidism, sublaboratory hypothyroidism, and we're also going to talk about hyperthyroidism and what you should do from a nurse practitioner standpoint. We're going to talk about patient presentation, laboratory evaluation, hormonal treatment with thyroid hormone, obviously, alternative options and supplements, and also how to monitor the patient. And then at the end of it, we'll talk about the business and practice considerations, okay? Where to order the hormones from, where to obtain labs from, how to bill insurance if you're going to bill insurance, how to price these services if you're doing a cash-based model, all right? So I'll go over all of that towards the end of the course. So it is my pleasure to have Justin Groce hop on here now and teach you guys the clinical components of thyroid optimization, okay? So he will take it from here. I will circle back around after he is done and we'll talk about more of the business practice considerations. I hope you guys enjoy.